So this is an area that my lab is doing a lot of work on. In older adults, there are mainly two kind of like big categories of brain small vessel diseases. Hypertensive brain small vessel disease and cerebral amyloid angiopathy. So using MRI markers can help one distinguish which hemorrhage is related to what kind of underlying brain small vessel disease. The presence of aneurysms, arteriovenous malformations, or other gross vascular pathology, that happens, that can certainly cause brain bleeds, but these are very rare in older adults. We always do some workup. We always obtain large vessel imaging to look for aneurysm or other treatable gross vascular pathologies. But again, this is rare. So malignancies such as brain cancer or metastatic brain disease also can certainly result into brain bleeds. Again, we always get MRI with and without contrast to look for an underlying malignancy, and we try to also repeat such MRI 3 months, 4 months down the line to make sure that we are not missing anything like that. So these categories, these kind of like secondary causes of intracerebral hemorrhages, they are fairly rare. The most common ones are brain small vessel diseases once again. We discussed the fact that there are two major types of brain small vessel diseases. One is cerebral amyloid angiopathy. This condition is characterized by more superficial brain bleeds and superficial microbleeds, what we call enlarged perivascular spaces in centrum semi-ovale, and lacunar infarcts in, again, lobar locations in more superficial parts of the white matter. The classical hypertensive small vessel disease is the more common etiology of brain bleeds, and that causes brain bleeds in deeper parts of the brain, microbleeds in deeper parts of the brain. It causes a white matter hyperintensity pattern, mostly in the deeper part of the brain, something that we call peribasal ganglia linear hyperintensities. Enlarged perivascular spaces in the basal ganglia, again in the deeper parts of the brain. So it's not too difficult. We have a number of MRI markers representing small vessel disease pathologies of the brain, and their location tells us whether a particular patient is more likely to have CAA, which gives the patient a much higher brain bleeding risk, versus hypertensive small vessel disease, which still gives the patient a much higher brain bleeding risk than compared to the general population, but less than patients with cerebral amyloid angiopathy. And some people have lesions in both locations, like a deep bleed and a more superficial couple of microbleeds whatsoever. These ones also mostly represent hypertensive small vessel disease. That was a contribution that came from my lab, and it's been reproduced in multiple different papers worldwide.